I want to start with a number that stopped me cold when I first heard it. 37 million. That is the number of Americans currently living with chronic kidney disease. And here is the part that nobody talks about. The part that genuinely keeps me up at night. Most of them have no idea. Kidney disease is called the silent killer for a reason. It produces no pain, no obvious symptoms in the early stages, no warning that anything is wrong until the damage is already significant. You can lose up to 90% of your kidney function before you feel sick, enough to see a doctor, and for millions of Americans over 65, the damage is being quietly accelerated every single morning by something sitting on their nightstand right now. Something their doctor prescribed. Something they take faithfully without question because they trust that if it were hurting them, someone would have told them. Today I am going to tell them now. Before I go any further, I need to say something clearly, and I need you to hear it completely. Do not stop taking any medication after watching this video. Do not throw anything away. Do not make any changes without talking to your doctor first. What I am sharing today is information, not a prescription. Knowledge, not a directive. Your specific medical situation is something only your doctor can evaluate fully. But what I am saying is this. You deserve to know what is in the medications you take every day. You deserve to understand the risks alongside the benefits. And you deserve to have conversations with your doctor that go deeper than the 11 minutes most of us get once a year. So let us have that conversation right now, together. Let me tell you about Margaret. Margaret is 71 years old. She lives outside of Nashville, Tennessee. She retired 4 years ago after 32 years as an elementary school librarian. She is sharp, active, and takes her health seriously. For the past 8 years, Margaret has taken ibuprofen every single morning. Not because she is in terrible pain, but because she has mild arthritis in her hands and shoulders. Ibuprofen makes the morning stiffness manageable enough to function comfortably. Her doctor mentioned it years ago as an option. She never thought to question it further. Last year, Margaret went in for routine blood work. Her doctor called her 2 days later and said her kidney function numbers had dropped significantly since her last test 18 months prior. Her GFR, which stands for glomerular filtration rate and measures how well your kidneys are filtering your blood, had fallen from 72 to 51. Her doctor told her she was now in stage 3 chronic kidney disease. Margaret was devastated. She asked what had caused it. Her doctor listed several contributing factors: her age, her blood pressure, and then he mentioned, almost as an afterthought, that long-term daily use of NSAIDs, which stands for non-steroidal anti-inflammatory drugs. Medications like ibuprofen and naproxen is a well-documented cause of kidney damage in older adults. Margaret looked at him and said, "You never told me that." He did not have a good answer. So what exactly is happening inside your kidneys when you take these medications regularly? Let me explain this simply. The way a trusted friend would: your kidneys receive about 20% of every heartbeat's worth of blood. They are constantly filtering your entire blood supply, removing waste products, regulating fluid balance, managing blood pressure, and performing dozens of other critical functions. To do all of this work, your kidneys rely heavily on specific hormones called prostaglandins to maintain healthy blood flow within the kidney tissue itself. These prostaglandins essentially keep the blood vessels inside your kidneys properly dilated and functioning. NSAIDs work by blocking the production of prostaglandins throughout your body. That is exactly how they reduce inflammation and pain. But when prostaglandins are blocked in your kidneys, blood flow to the kidney tissue decreases. The kidneys receive less oxygen. The delicate filtering cells begin to struggle. Over time, with repeated exposure, those cells are damaged. And kidney cells, unlike many other cells in your body, do not regenerate well. This effect is significantly more pronounced in adults over 65 for several important reasons. Kidney function naturally declines with age, even without any medication. Blood flow to the kidneys decreases as we get older. Many seniors have additional risk factors like high blood pressure, diabetes, or heart disease that already stress the kidneys further. Older adults process and eliminate medications more slowly, meaning the drug stays in the system longer and the kidney exposure is extended. The research on this is not new or controversial. The FDA has required warning labels on NSAIDs about kidney risk for years. The American Geriatric Society specifically recommends that older adults avoid regular NSAID use whenever possible. And a major study, published in the Archives of Internal Medicine, found that regular NSAID use in adults over 65 was associated with a significantly increased risk of acute kidney injury and accelerated chronic kidney disease progression. This is established, mainstream medical science. It is not fringe information. It is not alternative medicine. It is what the research clearly and consistently shows. Now, let me ask you something directly. Do you take ibuprofen regularly? Brand names include Advil and Motrin. Do you take naproxen regularly? That is the active ingredient in Alabay. Do you take any other over-the-counter pain reliever every day, or nearly every day for ongoing pain management? If you answered yes, I am not asking you to stop. I am asking you to have a specific conversation with your doctor at your very next appointment, and I will tell you exactly what to say in just a few minutes. But first, let me tell you about two other common medications that can also stress the kidneys in ways that most seniors do not know about. The second medication category is proton pump inhibitors, commonly called PPIs. These are acid reflux medications. Brand names include Prelosic, Nexium, Prevacid, and Protonix. They are among the most widely prescribed medications in America and are also available over the counter without a prescription. PPIs are extremely effective at controlling stomach acid. For people with serious acid reflux, Barrett's esophagus, or ulcers, they can be genuinely life-saving medications and should absolutely not be stopped without medical guidance. But here is what most people taking them every morning do not know. A landmark study published in the Journal of the American Society of Nephrology followed over 10,000 adults and found that regular PPI users had a 20 to 50% higher risk of developing chronic kidney disease compared to non. A follow-up study from Washington University in St. Louis, analyzing data from more than 125,000 patients, confirmed this association and found that the risk increased with longer duration of use. The mechanism is not fully understood yet, but researchers believe it may involve the effect of PPIs on magnesium levels, which are critical for kidney function, as well as direct effects on kidney tissue called interstitial nephritis, which is a type of kidney inflammation. The critical issue is this: PPIs were originally designed for short-term use, typically 4 to 8 weeks for specific conditions. But many Americans over 65 have been taking them daily for years, sometimes decades. often without periodic reassessment of whether they still need them at the same dose or at all. When was the last time your doctor reviewed whether you still need your PPI at the current dose? If you cannot remember, that review is overdue. Let me pause here because I want to acknowledge something. I know this information can feel alarming. That is not my intention. My intention is the opposite. Because the moment you understand what is happening, you move from being a passive person who thinks things happen to you into an active person who makes informed choices about their own health. That shift from passive to active is one of the most powerful things a person over 65 can do for their long-term well-being. You are not helpless here. You have options. You have alternatives. And you have a doctor who can help you navigate this. If you go into that appointment armed with the right questions. So let me give you those questions. Right now, here is exactly what to say at your next doctor's appointment. Question 1. Can we review all the medications I take and discuss which ones might be affecting my kidney function? I would like to know the risk profile of each one. Question 2. When was my kidney function last tested, and what were the actual numbers? Specifically, my GFR and my creatinine level. Question 3. For the pain medications I take regularly, are there kidney-safer alternatives we could consider? What non-medication approaches might help manage my pain effectively? Question 4. For my acid reflux medication, is my current dose still necessary? Has my condition been reassessed recently? Could we try a lower dose or discuss other management strategies? Question 5. Given my age and health history, how often should my kidney function be monitored going forward? Write these 5 questions down. Put them in your phone or on a piece of paper in your wallet. These are the questions that could genuinely protect your kidney health for the next decade. And now the part I know you have been waiting for. Because if these medications carry risks, what are the alternatives for managing pain and acid reflux? For pain management, the research supports several approaches that are gentler on the kidneys. Acetaminophen, the active ingredient in Tylenol, is generally considered safer for the kidneys than NSAIDs when used at appropriate doses. It is not without its own considerations, particularly for liver health at high doses, but for most adults over 65, it is a significantly better option for regular pain management than daily ibuprofen or naproxen. Again, discuss this with your doctor for your specific situation. Topical NSAIDs, such as diclofenac gel, which is available as Voltaren gel at most American pharmacies, deliver anti-inflammatory medication directly to the painful joint through the skin. Because very little of the medication enters the bloodstream, the kidney exposure is dramatically lower than with oral NSAIDs. Research shows topical NSAIDs can be as effective as oral NSAIDs for joint pain in many people. Ask your doctor whether this option makes sense for you. Physical therapy has consistently shown in research to reduce chronic joint pain significantly, often more effectively than medication over the long term. Medicare Part B covers physical therapy services. If you have chronic arthritis pain that you have been managing with daily NSAIDs, ask for a physical therapy referral at your next appointment. Gentle movement, particularly water-based exercise like swimming or water aerobics, reduces joint inflammation and improves pain tolerance through mechanisms that have nothing to do with blocking prostaglandins and therefore carry no kidney risk whatsoever. Many Medicare Advantage plans cover YMCA memberships through Silver. This is worth checking immediately. For acid reflux, lifestyle modifications can dramatically reduce symptoms for many people, eating smaller meals, avoiding food for at least 3 hours before lying down, elevating the head of your bed by 6 to 8 inches, identifying and avoiding specific trigger foods, losing even a small amount of weight, if applicable. These approaches do not carry kidney risk and, for many people, can reduce the need for medication significantly. H2 blockers. Medications like famotidine, sold as Pepcid, are an older class of acid reflux medication that work differently than PPIs and have not been associated with the same kidney risk profile. For people who need ongoing acid medication, this may be worth discussing with your doctor as an alternative. Now, I want to talk about something practical that every single person watching this video can do today, for free, in the next 30 minutes. If you have a patient portal through your doctor's office or hospital system, log in and look at your most recent blood work results. Find the line that says GFR or eGFR. That is your kidney filtration rate. A normal, healthy level is above 60. Stage 2 chronic kidney disease is 60 to 89, with other markers present. Stage 3 is 30 to 59. Stage 4 is 15 to 29. Stage 5 requires dialysis consideration if your GFR is below 60. Please call your doctor's office tomorrow morning and ask to discuss it specifically. Do not wait for your next annual appointment. If your blood work does not include a GFR, or if you have not had blood work in over a year, call your doctor's office this week and ask for a kidney function panel. Medicare covers this test. It costs you nothing, and the information it provides is invaluable. Your kidneys are doing extraordinary work for you every single moment of every single day. They deserve the same attention and advocacy that you give your heart, your blood pressure, and your cholesterol. I want to close with something Margaret told me when I spoke with her recently. She said, "I am not angry at my doctor. I know he is busy and he was doing his best. But I am angry that I did not know how to ask. I am angry that I took that pill every morning for 8 years without understanding what it was doing inside my body. I wish someone had told me sooner." Margaret has made significant changes with her doctor's guidance. Her GFR has stabilized. She now uses topical gel for her arthritis and does water aerobics 3 mornings a week at her local YMCA, feels better than she has in years, and she shares her story with everyone she knows over 65 because she knows that information, given to the right person at the right time, can genuinely change the course of someone's health. That is what I am trying to do for you today. Please share this video with someone you love who is over 65, someone who takes a daily pain reliever or acid reflux medication without fully understanding the long-term kidney implications. Your share could start a conversation that changes their health permanently. Leave me a comment below. Did you know about the kidney risks associated with these medications? Have you talked to your doctor about this? Or is this the first time you are hearing it? I read every single comment, and I respond to as many as I possibly can, because these conversations matter. Your health matters, and you deserve to have the information you need to protect it. Subscribe and turn on the notification bell for our weekly videos, because every week we have exactly these kinds of honest, important, potentially life-changing conversations built specifically for Americans over 60. Thank you for being here. Now go look at that GFR number, and then call your doctor. Your kidneys are worth it.